Our emotions, they're all over the place right now, right? But when the burden is so much for everyday life to go on for you, that's when it might be time for you to get some help. And join us this morning is Heather Ward, Director of Assessment and Referral Center for Forest View Hospital. Good morning. Thanks so much for joining us.
Morning.
Such a crucial topic for everybody right now. So I want you to go ahead and expand on that, on when it is time to seek help.
Yeah, so it's really important for people to know when they need to seek help for themselves or for their loved ones. Everybody can experience an increase in depression and anxiety. Maybe you're wanting to be alone more than you normally do or not thinking clearly. It's when those symptoms turn to where they're interfering with the day-to-day functioning of your life, and or if they are turning to thoughts of wanting to harm yourself or wanting to harm others, it's very important that you reach out for help. And one way to do that would be to reach out to Forest View Hospital to schedule a psychiatric assessment.
And walk us through the screening and the treatment process once they do reach out to you.
Yeah, so when you call Forest View Hospital, you're going to speak to a licensed trained professional. We're going to ask you a variety of questions. We're going to focus a lot on safety. We're going to ask you what's going on. Basically, why are you calling us today? We're going to get information about symptoms, presentation, and we're also going to get some basic demographic information from you. At that time, we're going to set up a time for you to come in person to Forest View and meet with one of our clinicians in-house.
And you just brought up one word that really jumps out in my mind, history. You really need to know your family history, right?
Absolutely. It's very important. We're going to be looking at a wide variety of things when people come in. We're going to be looking at history. We're going to be looking at current presentation. Once again, safety is key. That's one of our biggest focuses when we're talking or meeting with people. We're also going to be looking at what's your support system outside of Forest View. And we're going to look at all of those things. Our clinician is going to take all of that and consult with one of our psychiatrists. And we're going to use that to determine what level of care is most appropriate for you.
And some people kind of look at it as a sign of weakness. A lot of misconceptions out there about turning to you guys for an assessment, right?
Yeah, that is obviously a stigma that is still in place with mental health. There's a lot of misconceptions that if you reach out for help, maybe it's weakness, or maybe that you're automatically going to be hospitalized, and that's just not the case. We're going to look at what needs you have and what's most appropriate, and we're going to get you the help that you need. While that could be hospitalization, that could also be our partial hospitalization program, which is a Monday through Friday, 9 a.m. to 3 p.m. program. It might be our medication management clinic, and it also might be a referral outpatient. It's just important that you reach out for help so that we can help you understand what services are available.
And do you guys only treat adults, or is there something out there for children and teens as well?
Yeah, no, we treat adults and children and adolescents.
Wonderful. And also sometimes cost really holds people back. What's this going to cost me to do this assessment? I don't have it. And it adds more stress and anxiety. So what would you say to that?
Absolutely. So when you come into our assessment and referral center, there is no cost to you. There's no cost to you. We do not bill your insurance. It's a free assessment to help you figure out what level of care that you need. And our assessment referral center is open 24 hours a day, 7 days a week, available for you.
Do you think, too, sometimes people think, we're facing something historical that we've never faced before, so this too shall pass? Are people kind of like, I'll get over this, or at what point do they kind of need to realize maybe you are really entering a different phase mentally and need to reach out?
Yeah, so I think that especially with everything going on right now, people aren't always reaching out for help when they need to. They're scared to do so. And it's really knowing yourself, knowing that while we all can, like I said, experience depression, anxiety, when is it really impacting your day-to-day life? Are you able to function? Are you not functioning like you normally would? And also recognizing those warning signs in your loved ones. Are they acting differently? Are they more withdrawn? Again, are you having thoughts of harming yourself, thoughts of harming others? That's when it's really escalating to that next point where you really need to reach out for help.
All right, and to reach out to help, you can absolutely call 800-949-8439 or go to forestviewhospital.com. Thank you so much for your time this morning.